Hi, I'm Laura Fielding. This is part two for today. I'm Laura Fielding, Executive Director of Red Berets Medicare. Medicare for All. And I didn't expect to do a second, I didn't expect to have to break this into two segments today. I did episode 15. Was it episode 15? Yes, I did episode 15 just a little while ago, but I had a dental appointment. Unfortunate, I have dental care. Uh, Dental care is part of healthcare. Everyone needs to have be able to go and see a dentist. So there we go. I am back because I am going to have a meeting here in 1 hour, a Zoom meeting with Jason Call. He's offered to give me a few minutes of help on Zoom. I just feel nervous. Maybe I have nothing to feel very nervous about, but it is a really enormous opportunity to have been invited onto Amped Up Pod with Ryan Knight, Proud Socialist on Twitter, and I really want to do the one payer states, whole Washington, one of the leaders in this movement. So I would like to do whole Washington and the broader picture of one payer states, and as well the creative coalition of Red Berets Medicare for All, justice within that interview, within the 1 hour time that we have together. And so I'm super excited, but I do want to just make sure that I'm prepared to answer questions. I know that it's okay. Like, there's no way if he starts asking really in the weeds questions, I will have to just say, I know exactly where you can find that on wholewashington.org. I know exactly who I can put you in touch with. I have a couple of interviews that I can recommend to you. So that's the thing that I'm going to do is just, I'm not going to hem and haw about it. I'm going to be really upfront about the fact that I am, somebody who is new to learning the policy, because for a long time I've been, lazy is a really mean word, but I have just kind of leaned on other people and sort of used the excuse that, well, Jason Call really speaks the policy really clearly, sharply, fluently. You know, um, Cindy Jacobs, she's our policy person. Jen Nye, she's our communications director. She knows. So if anyone has a question about policy, I'll just say, I'm a knitter. I'm the creative person. I do creative things. I mean, not everybody can do a beret that looks cool like this, right? But if I get a chance to go on a podcast and it's to uh, in service to and speaking as a board member of Whole Washington. I'm newly elected to the board, so in my defense on that, I think it was okay to just be a volunteer and a creative person, and my contributions are creative. And I've been working, for Whole Washington and also trying to creatively bridge the gap between, not bridge the gap, help bring us more into the national conversation, because perhaps I'm sure it's not perhaps, it's because I've learned essentially almost everything that I know, and my ideology comes out of the experience that I now have organizing with Whole Washington, which is very much based on coalition organizing, grassroots organizing, valuing and respecting everybody's input, recognizing that we don't all have to be the perfect whole. It's okay for me to stand up and say, I am a knitter. I thought it would be a great idea to knit berets for nurse advocates for Medicare for All and the 99%. So that's kind of been my slogan, is knit for nurses and the 99%. As a very intentional, not as a kind of just a yes, as a visual show of solidarity, but also, this is labor. They're labor intensive. For the longest time, I was kind of just, oh, it's nothing. It's not nothing. Like, if Sarah Hansen is watching, or Michelle DVA, I'm sorry, Michelle, if I say your name wrong, Fran, lots of crafters who our little group of crafters who we've had at different points, a woman, a lovely woman named Cynthia Mascura, who lives in Grand Rapids, Michigan. And she saw my things on Facebook, and she was sending boxes of crocheted berets to us in 2018 for us to take to our Whole Washington Initiative 1600 launch here in Tacoma, because we had different Whole Washington Initiative 16 launches all over the state of Washington, with our little grassroots upstarts. That's what Georgia, I think she used to call us, a bunch of upstarts. And I think we're still that, because we have a lot of people within the Washington state, and I'm sure broader coalition of the single payer movement, who they have their, I don't mean to call it means tested, but there's their tried and true way that they have this plan of, this is how we're going to do it. This is how we're going to organize. And for us, that's not fast enough. And I would submit to people that think that we should all just fall in line and completely just subscribe to one method of one, sorry, not sorry, but take me a minute to get my thoughts. That we should all put our eggs in this basket and think we're going to read that. That's doing a lot of top down, needing to rely on a leader, on a progressive champion that's running, that can energize and mobilize the masses to where we can move as a, we're all moving towards Medicare for all. We're all fighting for it because we have this person carrying a banner. So much respect and gratitude. I would never have been involved if it wasn't for Bernie Sanders. I remember hearing all the way back, all the time ago, that I lived in England, that my husband and I lived in England. Your healthcare system is atrocious, and what a monstrosity, and it's like human rights violations, and how can you stand that? And it was just I would just shrink down, and I don't know, I never really thought about it. That's how a lot of Americans are. If you are raised in if you were raised in sort of middle class family that was able to get by comfortably enough and have healthcare, then you did not need to look at how desperate that so many people are in. And it's not because they're lazy and they don't work. It's because literally there's just look at our minimum wage, fight for 15. Nobody can survive on $15 or less. And it's 15 is that people are getting far less than that. So then how can you provide healthcare for your family? You might work 2 or 3 jobs, or you might work a job and then your partner is working a job or 2, or works nights, and you're trying to care for your children, and you're trying to put food on the table and, afford rent and all of that stuff. How do you do that on $7 an hour? I don't it's impossible. So, this whole thing, we need to get out of thinking that people that are hardworking poor people who just can't seem to get a leg up because they're, I could just go off on that. So yeah, but the insurance executives are never somehow they're entrepreneurial, and they're somebody that'll be looked up to. They're screwing us out of our life so that they can make more profit. There isn't anything accomplished or hardworking or amazing about any of that. It's predatory, and we literally have little people who don't get to have their parents take them to the hospital, and who aren't going to make it. We have 30 to 60 some odd thousand people who won't make it this year, just because people need to make more money. Their profit margins aren't big enough, and there's no corporations aren't going to regulate themselves. If you have the profit motive in healthcare, they aren't going to regulate themselves. They're constantly driven by the profit motive. So I don't think I'm telling anybody. Well, I might be telling newcomers who watch this and think, what is this weird thing that she's got on? They're red because National Nurses, which is the largest labor union nurses labor union across the country, primarily based in California, but lots of other places that they have chapters as well. They're advocating for all kinds of workers' rights, but they are a strong union in who wholeheartedly support Medicare for all. So the red is because I was like, I want to knit in nurses in red for nurses who advocate for healthcare justice. So that's why they're red. It's not some, I'm sure the more people start to see this, they're going to come at me with all kinds of hilarious names. Red is just a good healthcare color. And, you know, we spend more than double what most developed or industrialized nations spend, and we have much, much lower outcomes than the majority of them. And I can, again, I'm hopeful that I'm just going to provide a lot of resources. Like just this morning, I was on the Whole Washington YouTube channel, but you can also find it on wholewashington.org. You can go under information, I think it is, and everyone can figure out a website. Go look at the tabs. It's basically under the resources tab, and then you can find written articles and videos. So under videos there they have 3 or 4 that are currently up there. One of them is an interview with Cindy Jacobs, who is a nurse, and I forget what kind of lawyer, but she helped write the Whole Washington Health Trust, and works with did the study and stuff with Dr. Gerald Friedman. She helps break down the really fine points of the policy detail that I will have to listen to this stuff over and over again. I'm here to tell you, it's just like if Justin Jackson, if like I would tell him like I don't know anything about football, and it's not because I haven't asked about the rules. It's because like I either don't have the capacity or I don't have. It's probably I don't have the interest, right? So based on that logic, I do have the interest in healthcare. So why do I not have the policy like down? So part of that is applicate, like I need to apply myself. I need to make the decision not to just rest on oh, I am a creative person, therefore I'm going to leave the policy to other people. And I don't think it goes, I feel like the harder I try to listen to stuff, the more it just like, I'll really try to grab it as it's going in. And then I can't repeat it. I can't get it back. So, okay, maybe I am not as quick to pick it up and grasp it as other people, but I can still make the attempt and still keep trying. So now I'm going to get out of this narrative where I say, "Oh, I just don't really know the policy very well because that isn't like my expertise." Well, actually, I am going to try to put my face and my foot and my knitting needles forward, and I would like to be able to answer the questions and know the policy. In the meantime, when there is something that's asked of me this Friday or any other time, if I don't know the answer, the thing that I am determined to do is to tell people I know exactly where to get that answer for you. And this is not the end of the world. It doesn't mean that I can't be an advocate for healthcare, for single payer, for organizing, just because I don't know how to answer about ERISA waivers, or because I can't name boom, 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 here's how exactly it's going to be paid for. However, how it's going to be paid for, I should at least be able to name those bullet points off. And I don't feel like I can do that I would say, no, see, I've got to be able to spit that out or it's going to seem like I don't know what I'm doing. And so here I am. I'm going to wholewashington.org, and under information, and Jen Nye, our communications director, has been putting a heck of a lot of, she wants to make everything, because we want our new volunteers, whether they're in the state of Washington or whether they're people that are beginning to grow an interest in, wow, these people are working on this now. We want to check out if our state has one payer states. If you're a state that has the ability to do an initiative, you could use Whole Washington as a template and start to get ideas. It's not that Whole Washington knows everything. They're learning from other, one payer states. We're in a dialogue, and this is called us being innovative and also again, back to what Senator Nina Turner said, our movement needs to be more agile. And so that agility comes from being able to listen and communicate and, get into a dialogue on Twitter, and then somebody says something that maybe seems like, I don't like that. But then being able to catch that moment and then recognize, like, provide them with a question that they asked, or say, I'm going to tag somebody that knows the answer to that. And then they do. And then a connection is made instead of me just like saying, oh, piss off. I don't care about you. Because I don't like one thing that you said. And actually, she turns up to the meeting, the volunteer meeting, and now is coming to the whole Washington coalition with all kinds of amazing ideas. So I already, said credit, and everything. But I'm happy when I'm that makes me proud of myself when I'm willing to do that. When I don't get so locked into, I know the right answer and I know the right way, and I don't like that you have this opinion. Therefore, what? We would miss out on a person that might just have so many innovative ideas to add to our grassroots coalition. So back to Jen Nye, she wants to put everything available on the website so that new volunteers can go to the website, and there's so much that you could do as a new volunteer to create your own action items, right? There's so much of this that you can immediately get to sharing, if nothing else, on social media. So on the information tab, we have what is it, who's covered, what's included, how do we pay for it, why we need universal health care, how we get there, news, resources. Resources is what I had named in terms of the videos. So Cindy Jacobs, the policy wonk. Oh my God, I love you, Cindy. I did not, I made the mistakes on that brioche beret, and it's not her fault. It was me for thinking that I could knit a complicated style of knitting and also try to learn about ERISA waivers at the same time, because it was going completely smoothly and no mistakes whatsoever. And then there's this awful like blemish that's like 3 rows back, and first of all, I don't know how to tink. Tink is knit backwards. I can tink back really well on regular knitting, but brioche is kind of complicated if you're not used to what it is that you're unraveling, and then you can make an even worse mess of it. So what I decided to do was just be like, oh my God, that is an awful mistake. It's glaringly obvious on brioche or fisherman's rib. So do not think that you can get overconfident and knit a beret that is complicated and do that. But I am trying to kind of multitask and try to sit and learn the policy, and because I don't think I need to be everything to the movement, but I would like to be able to say things a little bit more clearly so I don't sound like I'm wishy-washy, or, I don't want people to be able to say, well, she doesn't know what she's talking about. She doesn't even know what she's fighting for. That is, if you don't know enough policy to be able to answer people's basic questions, then that leaves you very open to, so what? Like, you're saying we should do this, but you're not even going to tell me how to pay for it. So there we go. So then we have the savings estimator, which, so there's some other really awesome videos on the resources tab. I was naming all of them, but I have to get to what I was going to do here. The savings estimator, everybody can go in and put their, what their income, what they make, all of the numbers. And then the savings estimator will tell you what it is that you're going to save. And 90 to 95% of Washington state population is expected to save substantial money. So that leaves a fairly small fraction of people who will actually pay the same or a little bit more. And that's as it should be. That's because it's as it should be. So, and then we have frequently asked, well, right after frequently asked questions, we have SB 5204 full text. I think it's 67 pages. Another thing is, I feel as a board member and even as a dedicated volunteer of Whole Washington, it's like, yeah, who wants to wade through 67 pages? Not really, but also another part of me, I do. I want to be able to proudly tell people that I took the time to read 67 pages, which it's not amazing. We have really busy lives, but it's also not something that is insurmountable, and it should be done. We should be proud to say, yes, I've read the bill. I love this bill. Like, I love it, and I've read it. That's something we should want to say. So that is on my checklist. And then there is SB 5204 section summary. I don't know what that is. I guess it summarizes each. So if you didn't want to read the full text or think I'll get around to that when I get around to it, then go read the summary and see, if that's a little bit more of something you could bite off. All right. But I'm going to go to the frequently asked questions because this is going to be my study guide. And it's my study guide for in 40 minutes when I talk to Jason Call, who, if on the other video that I said that the Vanguard had reached out to me and said, do you want to join us on Friday evening, where Andre Stackhouse is joining us. Andre Stackhouse is co-hosting. Mostly he's hosting. I keep calling him a co-host because on the event they've actually put, I'm on the panel, so they've written me as a co-host. But basically it's going to be Andre Stackhouse who is hosting the whole Washington event that Justin Jackson will be our honored guest panelist for. And I'll say a few things, but I'm also going to have a script because you can see I need one. So, all right. So here are our frequently asked questions. So it will be tonight, Jason Call, Andre Stackhouse, and me on the Vanguard again, because they were really excited. Like, I was able to share some things. I think they got some things out of the interview. And then also, I really pretty much just told them straightforward, I really hope you have some other people from whole Washington that maybe can speak a little bit more concisely and fluidly about the policy. And so, you know what, that's okay. Other people cannot knit a damn brioche beret, right? And raise $125 for. So I needed, I need to toot my horn a little bit more, like not as in a bragging sense, but like stop being so hard on myself if the policy is difficult for me or not where I feel naturally gravitated to, because I do a whole lot of things creatively, and everybody knows that, but me, I'm just somebody who is still like being hard on myself. But I want to learn it, and I don't care if I can be the best at speaking it, but I'd like to speak it a little bit better. So the first question is, will this new system save Washington state residents money? Yes. In 2019. So again, see, but if I interrupt myself every 2 seconds, I'm never going to get through all of this. So there's a question that, the board is looking at about whether we're going to hire Dr. Gerald Friedman to do another study, because this study is good. It was done in 2019. Was it? Maybe it was updated in 2019. I mean, it was obviously done before our ballot initiative 1600 in 2018. Excuse me. But I think it's pretty solid still. But it would be interesting to get some COVID analysis in there, and also the opposition. And when I say the opposition, at this point, I don't even mean like people that are just like, hell no, I don't want the socialized medicine or whatever. I mean supposed single payer advocates who are busy just telling us we need to wait. Like they wanted to support this other bill that was a bill to study this. That automatically puts it off. At its best case, it puts this off for 4 more years in Washington state. And I think it also puts together a committee which would include industry people. So you tell me that whatever they put together is going to be anywhere near as good as for working class people and for cutting out the profit motive as whole Washington right now. That's preposterous. Like, it's not going to be as good. It's going to be, no, I am not a fan of that at all. So anyway, the point is they would look at this and say, well, you need to update your study, or you're using an old study. So probably Dr. Gerald Friedman will do another analysis so that it's up to date. But so now I'm going to read this without interrupting myself. So the question was, are you going to, will the new system save Washington state residents money? So in 2019, we are projected to spend nearly $80 billion on healthcare in Washington state alone under our current system. According to Dr. Gerald Friedman's Economic Analysis, a universal public health trust covering all essential health benefits will cost less than $70 billion, a savings of more than $9 billion in healthcare costs for Washington state residents, even accounting, and this is important, even accounting for costs related to expanding and improving coverage. The Public Health Trust saves on every aspect of public and private funded healthcare administration and improves the bargaining power for negotiate. So that's the important thing to remember. If I'm going to pull one thing out of this, is like it greatly improves our bargaining power to negotiate better drug prices. And remembering that Senator Cantwell and Senator Murray both voted against Bernie's bill quite a few years back that would have given us the power to negotiate the price of pharmaceuticals. So this is the reason why when people are attacking Ryan Knight for calling things as they are, like the Democrats have been working against us alongside the Republicans for, I don't even know, since the beginning, probably. Okay. They're not, like, they're in power now, and they aren't gonna get us anywhere close to this. They're never gonna, we cannot get our corporate Democrats to support this in any way, and in fact, Lieutenant Governor Denny Heck was very aggressive with me when I asked him face to face. He got right in my face and put his hand around, my forearm, because I challenged him. I said, I asked him, it's been a couple of years back now, I asked him, when will you co-sponsor HR 676 for Medicare for All? And he turned around because he was trying to make an exit. So I was like pressing him to answer another question or kind of following him to the door. But that still is not any excuse for the fact that he turned on his heel, came right into my space. And I'm talking about, like, we were close, right? And I hadn't even noticed him put his hand on my arm, around my arm, because we were in the eye to eye sphere. He got right in my face. The first thing he did was say, never, I will never co-sponsor that legislation. I know I do not support that legislation. And then I said, what is your plan then? I said, that's not good enough. I said, as a volunteer for Whole Washington, a veteran who has served in countries, and the veteran piece is, I think, that and the fact that I named that my sister lives in Canada and her life has been saved twice. So he got right in, probably because, like, as an intimidation tactic, because there's other people and other Democrats. These Democrats don't want all these people that are in the Democratic Party that show up to go canvass. This was a get out the vote canvassing event. And so they don't want us asking these questions, these really legitimate, basic questions, just asking, when are you going to represent your constituents? He was not my representative at the time, but he came to Tacoma to come help do apparently a get out the vote event and go canvass or go do something. He didn't go canvass because he was leaving right away. His aide was going to usher him out of there. And I was like, I'm going to, thinking to myself, I'm going to get my question in, and because I didn't just take his answer of never, and like, he was really aggressive how he said it, never, I am never going to support that. I do not support that legislation, which is, again, like, that's not even a good politician. Like, a good politician, I guess, is going to say, will you do me a favor and call my office? I mean, that's completely disingenuous because it's like, you're going to lie to me and tell me this. I guess he at least did tell me never, but he was very, very aggressive and rude and almost like, how dare I ask that question? How dare I ask him when he was going to co-sponsor HR 676? And then when I pressed him on, well, your answer is not good enough. I'm out gathering signatures to try to get health care for my fellow Washingtonians as a veteran who has served in countries that guarantee health care as a right, and someone who has family in Canada that loves She loves her healthcare. It has saved her life. So those are the kinds of stories and the kinds of things you don't want to hear from a veteran, especially a progressive person who comes in to say, here's what I'm going to use my voice to challenge the system. They don't want the rest of the people that are there canvassing as Democrats to hear that, because a lot of those people in that room probably thought that he support, because he would go around like the rest of them saying, of course, healthcare is a human right and we need to improve access. There are still a lot of people. So when they made this argument on force the vote, like that's not going to do anything. We already know who supports it and who doesn't. No, the vast overwhelming majority do not. That is I'm sorry, that's just not true. Just because the information is publicly available on that you can go and look up like people's voting record and how if they supported a bill, if they voted nay, if they voted yay, whatever it is, that's not information that the vast majority have. So we needed some clips on public record to put out there, not to say, yeah, we know who we're going to have to primary, we know who supports it, but we needed this to break the bubble of people believing that Democrats are for this. As a local former Democrat, albeit very, very limited, because I didn't put up with it very long. I just saw too much bullshit too fast. I'm not somebody who I'm not really efficient. So in certain ways, I like to waste but if I'm going to waste my time, I want to like figure out how to waste my time on my own. I do not want to go and think that I'm taking action on something and then have people like hamper down and dwindle down good, solid efforts. And it was my experience that is exactly what happens. And I'm now going to be very, very public about that, to basically say, when I went to local Democrat meetings, my local LD and 27th LD and Pierce County, I encountered, when I raised nearly 1,000, I raised 2,000, and I say we, because it wasn't only me. So there were a group of us who had crafted and who got permission. I was really shocked, but we did. So to give credit where it's due, we were allowed inside with our berets, and they didn't want, it was complicated with donations. They didn't want the donation to come, from Red Berets Medicare for All. I made a personal donation, and I had told people that came in for Pierce County reorg, which they do reorgs of the Democratic Party. That's to elect local PCOs are decided before that as part of the election. But you go in and you decide who's going to be the new chair of the organization, vice chair, basically all the board positions and everything, right? The executive board, the state committee members, all of that stuff is decided at reorg. And the reorg is really important because that's where you kind of decide if the progressives are going to take over and have, enough something to shift the power and really have the voting power on things that matter, right? Or whether it's still going to be the centrists that keep control of it. But my point was, even after going in and bringing those berets with a few fellow crafters, and it was a pretty big room of people and quite a lot of interest. People were, I am getting to the point. You will see how this point makes sense. We had a lot of interest in these because they're eye-catching and they're handmade. And when you can be there and people can pick them up and try them on and just kind of like, cool, somebody like handmade this. This is awesome for help for Medicare for All. And not everyone, sure, there's people there that know themselves well, and basically it's people that have plenty of money that are like, no, we don't want Medicare for All, but just like, ah. But there's actually quite a few people there within that are more a little bit like, yeah, it's great, I think we should have Medicare for All, but it's like, how is the best way to accomplish it? And they think that everybody, like so I talked to several people that day who actually thought that Maria Cantwell and other our senators and our representatives actually support Medicare for all when in fact they do not. And so I was not delicate but skillful, I guess is the word I would say, and just like saying not to treat them like idiots because they are not idiots. They're just people that are lied to. And yes, everybody should know. You know, let me hit something here. That's a notification I need to answer. Um, and so I might be wrapping this up if he wants to do the meeting a little bit soon here, which I got so far through my policy, didn't I? Through those questions. Isn't that amazing? Hopefully I've inspired you to at least go look through. Yeah, well, I'll say noon. We'll keep it at noon. Okay. Because then I might actually make it through a few more things. So where was I with that? Yeah, force the vote. It People do not know that Democrats don't support Medicare for all. Not everyone. Certainly, there are plenty of, Joe Biden. I don't want to categorize them all as older, but that are the facts. A lot of older, but there's also amazing older people who supported Bernie, and I don't want to be ageist in any of that stuff because there's so many incredible uh, older organizers and activists who have worked really, really hard to fight for this and stuff. So, but you just have people that go to these Democrat meetings, and it is like a club. Like you go there and you get to meet people, and it just becomes you're really the unpopular person if you're willing to say what needs to be said. Like when it came down to Pierce County deciding if they were going to vote to endorse Adam Smith or his progressive challenger, Sarah Smith. And I very, very clearly just I let she wasn't the chair at the time, but she did become the chair. I let her know, my extreme disappointment I said, I don't understand. Why would why is anyone voting to endorse him? He has taken so much money from the military industrial complex. He is, they got him actually. Pramila Jayapal got him to, or I don't know if it was her directly who did or whatever, but he signed on to Medicare for all. But he is somebody who, like, I have when it comes down to it, and that's again, it's why, like, really it doesn't even matter if somebody's he's an example of someone who has co-sponsored the legislation, and there's no way, like, if we come down to it and we can get a vote, like when it comes down to actually passing that into law, I know that we could the industry could definitely count on him, wanting to add amendments that weaken the bill or whatever, or just when it push comes to shove, not voting for it. I don't believe him, and I don't by that. So it's not the point that we thought we were going to win the vote or force people to kind of make that decision or anything like that. It's the fact that I've kind of lost the cogency of what I was trying to say there. It's the fact that progressives that are in this movement, and there I am using that word progressives again, but people who consider themselves to be really astute and up to date with, they watch a lot of independent media, and they really know the issues more so than any of your average people out there who are just have working lives. And maybe if they catch a few minutes of like CNN or something, maybe they think they're up to date on stuff. It's not people aren't stupid. They're just living their life, and they haven't had a way to be introduced to what they should be listening to. Well, to my mind, I'm like, how does anybody think that this system is working? But I've been introduced to organizers who have introduced me to a lot of things that I wouldn't have had before. So that's how we grow each other, and we introduce each other to more sources. And That's how we learn. And nobody, Ryan Knight's been through this thing where people are attacking him now for changing his mind. And it's like, yes, we're here to listen and to grow. If we were less informed before, which I think all of us were, most of us, nobody was, at least I wasn't. I will speak for myself. I've been through a real process over the course of several years. And again, a lot of that is due thanks to Whole Washington and Washington Bernie Crack Coalition, and all the people that I've been connected up to as a result of doing these, and basically being introduced to the broader community of Whole Washington. So I am so passionate about them because all of the advocacy work that I do has been offered. The pathway is being offered to me, and the resources. I've learned so much, and of course, I've learned from Bernie's broader movement as well. And done some of my own investigating. So again, it wasn't like Whole Washington spoon feeds me the agenda, but it's an organization that is not just talking. They're not comfortable talking, and it's not that they don't think we need a strategy, but it needs to be a moving strategy. It needs to be, okay, what is the action like this week? Like, we cannot just afford to sit around and plan and think that it'll be okay to get it eventually. So they have a good bill. We have a good bill right now. And that's what I was reading these questions and answers for, but they're awfully long and I just interrupt myself. So yes, essentially the answer to that question was, is our Washington state residents going to save money? Yes, in fact, we are going to save over $9 billion per year. And we will, so how would we say that? And it will give us, if when passed, it will enable us, or give us the power. That's it. It will give us the power to negotiate the price of pharmaceuticals. So it will give us bargaining power for the price of pharmaceuticals. You see, I just have to practice this over and over. It's okay. Some people are really good at doing that. I think I'll get better at it when I practice. It's okay. I have private insurance now. How will my employer-based healthcare be affected? Employers are averaging 12% of payroll. So what I do know, I can tell you that with Whole Washington, it goes down to 8.5%. At least I've memorized that. But I don't think I knew that the average was 12. I don't know if I would have said, I think I maybe thought it was a little higher, but still 12 down to 8.5% is really good. So employers are averaging 12% of payroll for employee coverage currently. During transition, employers who offer ACA compliant coverage to employees may opt out of the health security assessment for those employees. Our proposed health security assessment of 8.5% with an exemption on up to $12,000 in pay per employee each year means the average employer will pay under 7% of payroll to participate. Okay, so again, so that's like, so then I would say 8.5%, but with the exemption, they could pay under 7% of payroll in order to participate. And that's just stuff that's like, oh my God, I'm not going to remember that. Maybe I will. All right. This will be an appealing option, and many employers will simply be relieved to have a less expensive option to provide quality coverage to their employees. Employees will be able to opt in during the transition and decline their employer-sponsored coverage by paying the health security assessment on their pay themselves. Once 51% of residents in the state are enrolled in a state-administered health insurance, and many employers will no longer be able to opt out. Due to federal laws, employers maintaining health benefits under ERISA will be exempt for each employee their ACA compliant coverage. Oh my God. So see, this is like something I am not going to read all this right now. I hope Jason Call can tell me what I need to say in bullet points. Will the whole Washington Health Trust help workers who are displaced because of this legislation? Yes, there is a transition plan. I know that. I think it's 2 year, but let's see. It says yes. Section 123 on page 25 creates a displaced worker training account, which states the displaced worker training account is created in the custody of the state treasurer. Expenditures from the account may be used only for retraining and job placement of workers displaced by the transition to the trust. I do feel like listening. That's kind of why I was recording this, is because, but I'm not gonna. I don't think I'm gonna want to turn back around and listen to myself go off on so many tangents. So, Cindy Jacobs' interview, and then Georgia Davenport's recent interview is also on that. Along with Gerald Friedman, Dr. Gerald Friedman. So if you are somebody, if you're a crafter and you're watching this and you want to learn, what I'm going to do is just listen, to those interviews, because they actually, Jen Perlman, and then somebody did tell me what her co-host's name is, and I forgot it already. You see, it's a thing with memory, and I may not I may just not overcome it very well. But anyway, he asked some very good, sharp questions, some questions that people really would want to know. And it really was funny and delightful and also highly informative. Lots of good stuff in that interview. So I would, as a call to action, I would say, please go to wholewashington.org and go and find the videos, or go to just YouTube and look up Whole Washington, and you'll see Georgia Davenport's recent interview with Ron Placone. That was also really fun to listen to. So you've got Georgia Davenport with Ron Placone, you've got Georgia Davenport with Jen Perlman and her co-host, and that was an amazing interview. Jen wore her red beret, and she shared her story about her beret and two berets that were sent from Fran, who is a nurse who taught herself how to crochet. So she's one of the crafting artists of the red berets, just like Sarah Hansen is, and just like Michelle. And there's a few of us, and I'm so grateful. I'm not on my own. Doesn't okay. So doesn't moving to a single payer system have to be done at the federal level? I've heard that no state can afford to move to single payer without the money that the federal government provides for Medicare and Medicaid. We would not lose access to any current federal funds. The whole Washington Health Trust will contract to administer Medicaid and Medicare, which allows them to receive the funding they do today. In fact, federal contributions could increase. All residents would be assessed for Medicaid eligibility as part of enrollment to the trust. With significant loss of employer-based insurance, more residents are eligible, which results in more contributions to the trust. Additionally, the bill provides legal instructions to obtain all waivers to fully integrate federal funds into the trust. While this achievement will improve efficiency and administration, it's not necessary to start or stay solvent. This is just really great stuff that I wish I could just totally memorize, but maybe with enough reading I can. We can proceed with urgency. So you see, this stuff is already here. It's already here in the whole. So we couldn't get a hearing for this to tell the public that this is all here. The study has been done. The funding is all there. The implementation is all there. And it was just a delay tactic. 5399 was introduced as a delay tactic. And so then you have to ask yourself, and this is the problem with being all friendly with, the Democratic Party, or being friendly with, not saying being friendly like we can't all be friends. If everybody's for single payer, that's one level of kind of like agreement or solidarity. But at the end of the day, when that turns out to be really, those are the people that should support you, but they're actually introducing and supporting legislation whose very design is as a delay tactic, is to make sure that our hearing didn't receive a bill. Now, if they were in good faith about it, and weren't lobbying against us, and we were able to have a hearing for both 5399 and a hearing for 5204, where then we can debate the merits of making people who are uninsured wait, and so they can die in the time of COVID, or so we can study it and study it and do some more studies and study it. And I'm being completely facetious, as you can see, because I just think time and study is the province and the property of people who can afford it, of people who are privileged. If you are all of these people that are, I'm not saying you can't do good work as a paid organizer, but you have health care. So here's the irony of people that are organizing and have organized for decades for single payer, and then they have these staff positions, and they're not in dire need. They're not going to lose their child. They aren't having to choose between rent and healthcare and prescriptions, cost of prescriptions. So when it comes down to, like, we can say, oh, we can have some disagreements as a movement in tactic and strategy. But when that actually creates such a divide that those very people who are supposed to be on our side and we're supposed to be on their side, and it's not a side, we're all supposed to be fighting for universal health care. That's not a side. That's a big side. The 99% having coverage like 43 or 42 other developed nations have, that's not a side. Sorry. I'm just like, so when it turns out to be that they're literally like lobbying, they're literally helping the insurance industry sideline a fully funded implementable bill that is ready to go for people right now. I am, it's just like, you have some people with the Democratic Party that are like, well, they're not perfect and they're not great. You damn well got that right. But they're representing my interests more than Republicans are, and there's not an option, whatever. But I don't see. I differ from some people, and I think that populists differ from. It's like, you are working against me. You claim to be for the same thing, but actually you are every bit my political adversary. And that is very strong language to use, and I understand that. But when we are actually talking about people that are helping the industry and helping the politicians that are paid corporate toadies, corporate puppets, they work for the insurance lobby. People that are helping them help the insurance lobby, they are not my allies. Now, I know I put that in very, very bold terms, and there might be some people who would, well, we need to, we don't want to completely alienate these people. They ultimately believe that we need it as well. And that's fine if they were making their testimony, but saying, but please also, I do hope and suggest and strongly advocate that while I think that we should do the 5399, I also would support 5204 receiving a hearing. That way we can have a public debate about it. That's only what's right and what's fair, especially during the time of the pandemic. Then I could turn around and say, yes, I will now say that, we're working in collaboration. We have a strong disagreement. I seriously don't understand why we need to wait when we have a fully funded bill. But in good faith, at least you're saying that this implementable bill that's ready to go right now deserves to have a public hearing. So now maybe I wouldn't use that language that we're diametrically opposed, but when you are really working against us to halt the progress of people getting the care they need right now, I don't know what language to use to describe that. I would not call you my ally, though, because you're making us lose, like we're losing, and people are losing their lives. So that's just not, I don't know what kind of label I can come up with for that. But I think I certainly spoke my piece on it, didn't I? And that is, and then we have, I'm self-employed with no employee. no employees, do I pay the payroll tax? So, this is just really, let me get a no. Okay, so the simple answer is no. At least I can memorize that. If I'm self employed with no employees, do I pay the payroll tax? No. The health security assessment tax on payroll would not apply to sole proprietors' earnings from self employment. However, sole proprietors will owe an annual personal health assessment of 2% of net earnings from self employment. Starting in 2022, self-employment residents will be required to enroll in the minimal essential coverage. I mean, this is all really important. I don't mean to skim past it. I need to go through and will current Medicare and most other federal program enrollees be eligible? Yes. This is the part that gets into ERISA waivers, though, and the waiver process. So, yeah, I look forward. Here I am. I'm like 4 minutes away, so I've got to go. And I feel it's good because I'm so happy that Jason is willing to offer some help. I hope he kind of just says, Laura, I think, just stick with, you have a lot that you can share. The most important thing is getting people involved. I would love it if somehow I could go on to, I would love it if we had the problem, the good problem to have, that if I went on to Ryan Knight's podcast or the Vanguard, and if I said, I really, really want to see us grow this coalition. I don't know if anyone, all the people that are watching, maybe you don't know if you have a state-based coalition. Why don't you sign up to be, why don't you go to Whole Washington events and go to the Monday night meetings? You can sign up right on wholewashington.org, go to events, click on the weekly Zoom, sign up, and come and join us. Wouldn't that be an amazing problem to have if all of a sudden we had maximum capacity in our Zoom because people from Texas and, Arizona, I don't know why I named those two. Whatever. Utah, Kansas, Arkansas, I don't know. New York has a New York Health Act, so, but wouldn't it be a cool and interesting problem to have if we actually had a national sort of volunteer? Then what we would probably have to do is say, cool, we actually are going to have the local volunteer meeting, and then Georgia or Jen Nye, who are basically our point people for the one payer states organizing. They're building these coalition partners. I do it to an extent on Twitter. I try to keep up with Whole Washington, who's mainly doing it. But I think because of the national messaging of Red Berets supporting the movement, I've done a hell of a lot of tweeting on that. So I also don't want to cut myself short and say, because I do think like Healthcare for All Los Angeles has been, we've mutually followed each other for a long time and connected, and I think people have seen my messaging of, this is a creative show of solidarity for everybody for fighting for it. All things good, strong Medicare for all candidates at every single level, and state level orgs, and just as a basic show of solidarity. When you can go to your town halls, even on your Zoom, you can wear them on your Zoom town hall. Show up and have a red beret, and have your if you're in Texas, and Sema is it. How come I always forget if she says Sema or Sema. I say Sema, and I need to know. But we made these cool buttons of her, and she's wearing a People's March for Medicare for All, and her red beret with her little red and blue rose there. So way cool. And anyway, so you can wear whatever buttons. You can wear DSA buttons. You can wear Our Revolution buttons. You can wear your local state org. You can just have Medicare for All. But to show up in something like this with a thing that says Medicare for All, it's a way of saying this is something that we're fighting for, But you don't have to wear a red beret. You don't have to wear anything. Just say Medicare for All and do an action today and try to get locally connected, because it provides a heck of a lot of focus and hope when people spend way too much time thinking that they're going to influence Joe Biden. They're not. And I don't mean to say like, but he was very purposely like, we don't have Bernie Sanders because the establishment was hell-bent on making sure that they had someone who could block that policy. They didn't care about Bernie Sanders. Like, they cared about what he cared about. Like, they don't want Medicare for all. They don't want infrastructure deals. They don't want to end the wars. They don't want to end the prison industrial complex. So they don't want a Green New Deal. They don't want any of that stuff. So that's why we don't have Bernie Sanders. That's why the media worked against us not to have a progressive populist. So anyway, yeah, thank you everyone for joining, and I will hopefully get some pointers from Jason, and can always loop back and visit Hull, Washington again on their Q&A. All right, bye.